Hormonal controls. This is where we actually look at the hormones that are affecting the glomerular filtration rate. Now we have atrial natriuretic peptide that will actually cause increase in the blood volume, which of course will then cause more filtration. Okay, increases in the filtration rate. As opposed to angiotensin II, which will reduce glomerular filtration by causing vasoconstriction, okay, of the afferent and the efferent arterioles. Hormonal. The hormones, you should keep track of them, just so you know, okay, as we're going along. You should recognize what's going on as far as the other regulations. I will also tell you, the PowerPoint does have a lot of things where we're going to actually see things that look like it's repeating, mainly because we're going through one section at a time. And as we go through one section at a time of the nephron, it's going to sound like very similar discussion, okay? So I'm trying to give you a heads up as we're going along. So if you're thinking, well, we just talked about that, we may have, but it may be a different portion of the nephron, okay? Especially when we get to the tubes, okay? So, do you guys follow the glomerulus?
Can you explain the A&P again?
A&P. Basically what happens is it increases glomerular filtration because it's actually causing, the hormone itself is actually causing an increase in the blood volume, which causes an increase in the surface area, which then increases the amount that gets filtered at the Bowman's capsule, at the glomerulus. Who has that foghorn going out? I didn't see any fog out tonight.
That was my out.
Oh, okay, is that what it was?
Was
Okay.
it vibrating?
All right, I just want to make sure, I keep hearing it, I'm making sure if, I'm, you know, who knows, you know? I mean, I've been to, lighthouses in the past, and I've heard really loud foghorns right at the lighthouse. What's that? Oh, yeah? Okay. There's a lot of them in New England.
This was in
Okay. All right. I've been to Maine. All along the coast of Maine. Lobster in Booth Bay Harbor. Places like that. Trenton Bridge. I had lobster right at Trenton Bridge. There's it's right before you go over the bridge to get to Cape Breton Island. I believe it's Great Cape Breton Island. Or is it? No, that's Nova Scotia. Okay. Anyway, I've been there too. It's actually the island where Mount Desert Island, my mistake. That's where what's that famous harbor where Jackson Laboratory is?
Bar Harbor?
Bar Harbor, yeah. The Jackson Laboratory is right around the corner where they do research. Anyway, any questions about glomerular filtration? Okay, let's take a look at tubular reabsorption and the secretions. Okay, it's going to break it down. Right here, there's going to be, and I want you to realize, where are we really looking at this happening? What do you think? The tubes. Which tubes? Which tubes do we have this happening? Proximal convoluted tubule. Okay, so let's put this. Which one? This one? Or the distal? Okay, distal convoluted tubule. What else? The loop of Henle. Yes, the loop of Henle. So we'll just do L of H, so you guys can recognize it. We do have, in some cases, a little bit in the collecting duct, but that's really what we don't want to talk about right away. So I do want you to realize that. That's where actually the antidiuretic hormone has a more of an effect, just so you guys know. So, the reabsorption, I mean, think about this. What are we really looking at? Proximal convolute, you have microvilli. We're actually having a lot of passive and active transport. We have osmosis occurring because, remember, water follows the sodium. As the sodium changes, the water follows because it's going from areas of high concentration of water to lower concentrations of water, because when the sodium leaves, what's left? The water. So the water follows. So that's why. We also have some pinocytosis going on, which is more of a phagocytic occurrence, right? Now, we also have it, one of the interesting things that we have, yeah, 99% of the filtrate is reabsorbed. So when we look at, let's say, this image,
99%
99%
what?
is
Filtrate.
reabsorbed. So when we're looking at it, this is what we actually see in the tubes. Here's the thing. This is inside the tube. This is the cells of the tube. This is the tissue area. And then we have the the peritubular capillaries that we talked about that are surrounding the different tubes. So a lot of times what we see is some of it will go transcellular and some of it goes intercellular, in between, where the cells come together. Okay, because there's a narrowing here, and so they can pass through very easily there, but as opposed to going through the entire cell itself.
So you said transcellular or what?
Sure. They do a lot of transcellular, but that's more where we see the active transport.
And what we do?
Intercellular, okay, where it's between the cells. Okay. And I figure if I show you the image, you'll get the concept right away before we talk about it. Okay, that's why. So, and like I said, we're going to go back and forth between different sections of the tubes, and I want you to realize that. A couple things that you also see. pH is actually affected. You actually have hydrogen ions released also in your urine. This is one, anybody, I'm going to ask you a very, very interesting question. Anybody ever get stung by a jellyfish? You have.
Yeah, but it was so long ago, I barely remember it.
Okay, you don't remember what happened or how you treated it.
I was at the beach, and I just remember like.
I would hope you were at the beach when you got stung by a jellyfish, right?
Yeah, and then I felt like pain in like one of my legs.
I'm sorry to hear that, but I wanted to ask that question to see if any. I had a student today, or was it yesterday, mentioned it too, that they got stung by a jellyfish. So that's why I asked the question.
Jeez, I'm throwing urine on it.
Yeah, that's what they did. They threw urine. Don't ask. I didn't ask how they did that, but they threw urine on it. Okay. Why? Because it has the acid, the hydrogen ions from the urine. But you don't have to necessarily put urine on it. You could put vinegar on it, or tea.
Yeah, tea bag.
You know, a used tea bag you could throw on it. And their recollection was a little bit more current, and they actually remember it lasted about a month and a half. Okay, well, okay. I remember somebody even before that, they had you know what sea anemones are?